Sindhubam, we'll just wait for 2 minutes and then start.
Okay.
Madam, shall we start now? Others will join, I think. Sindhu ma'am.
Okay, I think most of them are joined. Ajay, hello.
Hello ma'am. We'll start the meeting. I invite Dr. Sindhu TG madam, our Vice President of IAP Kozhikode, to welcome the gathering.
Okay. Good evening. A warm welcome to IAP Kozhikode. Today we have our talk on this Doyens series, and this week, all of you know, it's adolescent and childcare. We are continuing that observation. So we had this talk. Before going to the proceedings, I have one more things to do today. All of you know that today our IAP Kozhikode has lost one of our senior member, Dr. Radha, mother of our Dr. Geeta Rajan madam. So I think we will observe 2 minutes silence to pray respect to her. Okay. We will move on to our programs. Today we have this talk on this Meet the Doyens program. Ajay, whether Jairam sir is here?
No, ma'am. No, ma'am.
No. So today's program is on anger management in adolescents, and to talk on, here we have Dr. Preeti madam, and I request Dr. Shaji Thomas John. Sir is the past president of IAP Kerala and past chairperson of Central Adolescent Health Academy. Sir, I request you to introduce the speaker and to moderate the session.
Well, thank you, Dr. Sindhu. Now the topic for the day, as you all know, is anger management in adolescents. It's part of our Child Rights Week celebrations, and we have a usual Beyond Horizons Meet the Doyens. And for that, this time we have Dr. Preeti M. Galagali with us today. Anger is a strong feeling of being upset or annoyed because of something went wrong or something became bad. And that feeling makes someone want to hurt others, to shout at others, to do a lot of things which can create a problem for the person who gets it. We all know, we have all gone through this feeling of anger, and even mature people like us, we are not able to control our anger. Just think of the status of the adolescents. Their brain is not fully matured. The frontal lobe is dictating terms to them. And you have this period of COVID where you are tied down to your home. Well, to listen to how this can be managed, we have a very eminent person with us on anchor management in adolescence. It's my privilege to introduce Dr. Preeti. Dr. Preeti is the Director and Adolescent Health Specialist of Bangalore Care and Counseling Center. She was a Central IAP Executive Board member in 2021, a review editor for Frontiers Journal, a national coordinator, IAP Digital Wellness and Screen Time Guidelines Committee 2021, national convener, IAP Awesome AYA Program 2021, and Suicide Prevention Program 2019. She's international lead, International Adolescent Health Week 2022-23, a member of the Education Committee, International Association of Adolescent Health, member Nutrition and Mental Health Committee, Society of Adolescent Health and Medicine USA, and chairperson of the Adolescent Health Academy in 2019. She has more than 20 international and scientific publications, and she has presented more than 200 international presentations for meetings. She has had various awards. She is the fellow of the Indian Academy of Pediatrics in 2018. She has an international scholarship in 2017 by the Society of Adolescent Health and Medicine USA. She got the Best Research Paper award in 2005 and 2011, and she was a gold medalist for her MD Pediatric Examination in 1992. She has given 2 orations. One is in Kerala in 2017, the MKC Nair oration of the Adolescent Health Academy of Kerala. Well, we have here a very good speaker who has an in-depth knowledge on the subject she's going to talk about. A mesmerizing person, a good old friend of mine, somebody who had helped me a lot when I was the chairperson of the Adolescent Health Academy at the national level. I present to you Dr. Preeti M. Galagali. Over to you, Dr. Preeti, and all the best.
Thank you so much, sir. Thank you for that very nice introduction. It's a pleasure to be talking on the platform of IAP Kerala and especially IAP Kozhikode, which is very, very close to my heart. In fact, I owe what I am to Kerala today because that's where I got my training in adolescent health. So I start this presentation of mine paying respect to my teacher, Dr. NKC Nair. Can you all see my slides?
We can see it.
Thank you so much. So welcome to anger management. And you can see all the angry birds sitting there. We are going to, in the next few minutes, think about how we can replace hate with hugs. And that is going to be the key objective of today's presentation. Important to remember that anger actually is an emotion, as Dr. Shaji Thomas already said, when we are either very tired, we have not had enough food to eat, we are very sleepy, or when things don't go our way. When we want something and we don't get it, it could be an ice cream that we are eating and somebody comes and dashes with us and the ice cream falls down. Or somebody comes and says something to us which we don't like. Somebody might tease us, but there are certain emotions which are behind the anger, and anger is often called an iceberg emotion. An adolescent, or for that matter, even we may be scared, trapped, embarrassed, offended, guilty, grumpy, jealous, regretting something, sad or shame, and what comes out is actually anger. Anger is not all the time bad. We all know from history, Gandhiji, Rani Lakshmi Bai, Abbakka Rani, and the great Baswaraj. They were Basveshwara. They were all angry with the system. Gandhiji with the British for not giving independence to India, And Abakarani and Rani Lakshmi Bai again angry with the British, and Basveshwara wanted to do social reforms. And these are the people who changed the face of India and in fact changed the face of world. So anger is an emotion which we do not term it as bad. What we term it is as an energy which has to be used in a constructive way. And you would tell me these are all adults. So what if they did all this? And what about adolescents? And we have seen in the recent past, we have young adults like Neeraj Chopra, who won the first gold medal for India in Olympics in javelin throw. He overcame the feelings of anger when he was bullied as an 11-year-old and when he was called a fatso. So you see, anger, they can manage the young people. Lovelina, she's also less than 24 years old, and now with an immature brain, she had a bad attack of COVID. She was extremely angry, but she went on to win an Olympic medal. And Avani Lekhara, she had a road traffic accident at the age of 11 years, extremely angry, dejected, and disappointed, but again overcame that anger to win 2 medals in the recently concluded Paralympics. So how come these people could overcome their anger even though they were not yet complete adults, as I would say? So let's in the next few minutes understand why is anger so very common in the adolescent period? What is the neurobiology of anger? What are the consequences of uncontrolled anger in adolescents? What should be a clinical approach in our practice? And I will finally end with a few practical anger management techniques. We know about adolescent, it's a phase of ranging hormones. There's so many biopsychosocial changes which are taking place. And if the adolescent does not have support from the family, from the other adults whom he knows, and also from peers, this can be angry movement. So anger is in fact normative in adolescents to some degree. We often call them as pangs of growing up. Adolescents do get angry when parents tell them what to do and they say, I know the best, I know what is best for me, I don't want your advice. So they are bits for autonomy. And when parents don't understand this, this can lead to anger and aggression. We often know that adolescence is also a phase of identity crisis, which is rather uncomfortable. And as they are experimenting with their various identities, people around them lose their patience, and that makes them angry. What's the profession that I want to do? What kind of clothes that I want to wear? What kind of hairstyle that I want to have? Whom do I want to have an intimate relationship with? So these are some of the identity crises which adolescents face, and they need understanding adults. Otherwise, they do get angry. And they often say that nobody understands us. And the media, well, that's complicating things as well. As it is, adolescence is a phase of rapid change. Media, in fact, is sometimes blocking the communication between the adolescent and the other trustworthy adults. And that too makes the adolescent as well as the people around them angry. And anger often has a ripple effect in the family. If one person is angry, the others get angry too. And then there is the pulling from the peer group, the media towards one side, while the pulling is from the other side by parents. So the adolescent has to fulfill the family expectations, the teacher's expectations, the peer expectations, the media expectations. And if they do not have understanding adults, they are going to be angry because everybody is going to be always correcting them. And the immature brain does not make things any easier. And we would be talking a bit about this in the next few minutes. So how does anger actually affect our brain and body? The first spark of anger activates the amygdala before even we are aware of it. And then the amygdala activates the hypothalamus. The hypothalamus signals the pituitary gland to discharge corticotrophin releasing hormone, which in turn activates the pituitary to secrete ACTH, And then the adrenal glands get stimulated to secrete adrenaline and noradrenaline from the adrenal medulla and cortisol from the adrenal cortex. And we know adrenaline and noradrenaline, they increase the heart rate, they increase the blood pressure, they push more blood to the brain and the muscles, and cortisol causes glycogenolysis, increasing the availability of glucose to fight stress or anger. And when the anger goes down, all the hormones come down to normal. And that is what we would like to help the adolescent in controlling the feelings that he has, that is control of his limbic system. We would like to increase the parasympathetic nervous tone, which will set in relaxation. We also know that when there is high emotion or hot cognition, there is often a hijacking of the brain by the amygdala. The prefrontal cortex actually loses it, and the prefrontal cortex is the one which controls emotions and also has an important role in decision making. So what happens here, instead of responding to a situation, the adolescent often reacts to a situation because there is an amygdala hijack. So there are some particular reasons why there is increase in emotional reactivity or anger in the adolescents. As I said before, rapid biopsychosocial changes and increased in psychosocial stressors, mainly because of demands and expectations from family, from the educational system, and also from peers, and unavailability of trustworthy, non-judgmental adults to help the adolescent through this important but challenging phase. There is a very highly reactive limbic system and a reward system, but a poorly developed prefrontal cortex, as can be seen in the functional MRI images. Here, the blue area showing maturation or myelination of the brain, and you can see the myelination of the brain only completes in the late 20s. Now, in cases when we have taught the adolescent anger management, when there is a highly stressful situation, there again the amygdala tends to hijack the brain, and these are the situations of hot cognition. So what do we need to do? We want to make sure that under low stress situations, under conditions of cold cognition, the adolescent is repeatedly taught anger management and stress management techniques to actually wire the developing brain in such a way that he has an excellent anger management technique and control of emotions. In the adolescent period, there is poor stress management due to immature hypothalamic pituitary axis. So often under stress, there is a cortisol storm which occurs, and hence there is increased emotional reactivity. Also, the adolescent has lack of effective experience with coping with emotions, and there's a big role of trustworthy adults in the life who have enough experience with coping with stressors and emotions to guide the adolescents. Often the adolescents misinterpret facial expression, like the expression of surprise may be misinterpreted as anger, and this sets the amygdala into action immediately. So adolescent has to also learn how to recognize appropriate facial expressions so that he does not overreact. But remember, there's a window of opportunity in the adolescent period. Though there is a high vulnerability to anger, aggression, and violence, there is a window of opportunity that the brain is under construction, and the anger management techniques which we teach them in this age group will often cause hard wiring of the brain in such a way that when they become adults, they are cool-headed individuals. And that is the aim of all pediatricians, adolescent health specialists, and gatekeepers of adolescent medicine, to give this training to the adolescent. So why does an adolescent get angry? Actually, there are many causes, and I will just touch upon a few. We often call them as the socio-ecological determinants of anger, aggression, and violence. Coming to the individual factors, a person may have a difficult temperament. A temperament is what he is born with. So individuals with difficult temperaments are known to be highly emotionally reactive. Or there may be an adolescent who's born with a slow to warm temperament, so he does not express his emotions properly, and there is uncontrolled anger within. He represses his emotions, ruminates, and that can cause poor health. There could be a mental disorder, like there could be a neurodevelopmental disorder like ADHD, ODD, and conduct disorder, which are often associated with violence, anger, and aggression issues. There may be poor role modeling of anger in the family, where there may be parents who get very aggressive and violent when they get angry, and the adolescent just picks up those poor management techniques. Or there may be a difficult situation in the family due to poverty, due to an alcohol use disorder, or any other mental disorder, which puts the whole family functioning in disarray. There may be peers who are more violent, and adolescents tend to follow peers in this age group, and that could be making the adolescent more angry and violent. Or an adolescent may not have enough peers, or he's getting bullied by the peers, or there is sexual abuse. So these are the things which can make the adolescent very angry. Coming to the community, the adolescent may be living in a violent neighborhood where violence, firearms, and weapons are the norm. In school, he's not doing well. There is a learning disability. There's probably an ADHD. There's no remedial education facilitator there, and that can cause a problem. Media messages, violent games on the media can push the adolescent into copycatting and decreasing his sensitivity to violent episodes and adopt anger and violence as a way of life. Of course, policy making, adolescent-friendly health services, a lack of which, it's lack of counseling for these children, which is so much required, and the Juvenile Justice Act, which actually treats adolescents from the age of 16 to 18 years as adults when they do heinous crimes. So these are the things which may make the adolescent very, very angry. But in the various domains, there are protective factors like parental connectedness, school connectedness, religiosity, and spirituality are found to be the most important protective factors, not only against aggression and violence, but against all high-risk behavior. Now, important thing to remember is what the adolescent faces as a child has huge implications over his adolescence and adulthood. Early harsh parenting can lead to conduct problems, school failure, which in turn, yes, there is low parental monitoring, so he gets attracted towards deviant peers, increased adolescent anger and aggression, and this in turn leads to alcoholism, marital conflicts, depression and abuse when he becomes adults, and even poverty because he cannot achieve his potential. So the circle of violence continues. And where can we intervene? As a healthcare professional, I think intervening right in the early stages, right with the parenting techniques, is extremely important to break the circle of violence. And as Sir said, COVID-19 pandemic has actually brought forth many issues which has actually spurted a lot of anger in many adolescents. It could be school closures, loss of peer contact, it could be socio-economic distress in the family, food insecurity, parental stress, loss of play, child abuse, low household income has made the adolescents of today very, very angry. Important thing to remember is that there are a few mental disorders which can present with anger and aggression and violence. And usually this is extreme anger. And we as pediatricians should keep our eyes open in each case and screen for these disorders. A few examples are ADHD, oppositional defiant disorder, conduct disorder, intermittent explosive disorder. Yes, depression. Depression in childhood and adolescence can present as anger. obsessive compulsive disorder, bipolar, disruptive mood dysregulation disorder, autism, learning disorders, anxiety disorders, and substance use disorders. So anger could be normative on one end of the spectrum, but it could indicate a serious mental disorder on the other hand. Adolescent aggression typically follows into two groups. One is the life course persistent and the other is the adolescence limited. So what is the life course persistent? Usually these children present with anger aggression in the early ages, as early as 2 years. And in fact, 2 years, most of the 80% of the young children do have some anger issues because they're not able to express themselves properly at that young age, especially if they don't have the language ability, and also they have poor emotional regulation. But nearly 12% of them do not have these anger issues as they go into the older age group, that is around 8 years or so. But there is a certain group in which aggression is a stable trait, and these are the ones which are going to have problems later, and these are the ones which actually need the help of a psychiatrist and a mental health professional, because they tend to become juvenile delinquents later and go into criminal activity if aggression and violence is not managed properly. While those in the adolescent limited age group, those we present with anger and aggression, are usually because of some psychosocial stressor in the adolescent period, or when they are copying their peers. So these are the ones which are easier to manage, and when the adolescent period is finishes and when the brain matures, they become an adult. Usually if they are managed properly, they do not have much problem in when they become adults. Another difference is in boys and girls. In girls, anger is often a relational aggression, which they may not talk to the other person or may even bully the other person. While in boys, it is more of physical aggression, which is seen. So what are the consequences? Why do we want to actually control anger in the adolescent period? I think the most two important consequences if an adolescent is very angry is the loss of interpersonal relationships. It could be with peers, it could be with family members, it could be with teachers, or it could be with the community members. So that is one big loss if there are too many anger issues here and if it is an uncontrolled anger. But always remember, we embrace anger as an emotion. Anger itself is not bad, but we need to control it and make sure that it does not cause more problems. Another consequence of excessive anger is inability to achieve their potential. It may be in academics, it may be in sports, it may be in their other special talent like music or dance. So these are the two main consequences. We also know that anger can lead to excessive eating, and most of the obesity is because of emotional eating under stress. Also know that anger can lead to excessive and unhealthy media usage and even internet gaming addiction and internet addiction disorder. Also in anger, risky driving is known, bullying is known, sexual violence, taking drugs and substances, even self-harm, and the initiation into mental disorders. So we know that anger can lead to immediate consequences, short-term consequences, and long-term consequences, because uncontrolled anger, the increase in adrenaline and noradrenaline and cortisol for a long time can actually damage the brain. Cortisol is in excess is a neurotoxin and it can damage the hippocampus and the prefrontal cortex. We also know that cardiovascular diseases, joints and muscles, the gut diseases like diarrhea, constipation, even altering the gut microbiome, even triggering inflammation in the whole body, leading to non-communicable diseases like diabetes, cancer, chronic lung disease, heart disease, and stroke. We also know that excessive anger because of increased cortisol, can damage the functioning of T lymphocytes and damage the immune system. And that's the reason, especially in COVID, when we say we must keep cool. That's important if we want our immune system to be strong. WHO has said that 33% diseases and 60% premature deaths in adults are due to behavior and conditions that begin in adolescence. And uncontrolled anger is one of them, which in turn leads to unhealthy diet, physical inactivity, alcohol abuse, and even tobacco. So if we have to prevent the tracking of NCDs, we need to deal with anger management appropriately. Now, we also know that increased anger can lead to aggression and crime. So what is the condition of juvenile crime in India? Some good news from the latest data that there has been a decline of 7.8% in cases registered against the juveniles, and the crime rate saw a drop from 7.2%. Was it due to a lockdown? What the adolescents in lockdown, was that the reason? Or have they learned to really control their emotions is something which we have to think about. And yes, the maximum crimes are committed in the age group of 16 to 18 years. And hence, we need to start anger management strategies much earlier in childhood and in early adolescent itself, if we want to really control the more serious, heinous crimes in the country. Not good news as far as juvenile sex offenders are concerned. And what they have observed is that though the overall juvenile crime is coming down to some extent, but over the years, more and more sex offenders are in the juvenile age group. And hence, we need to do a lot of sexuality education and also anger management in this adolescent age group. But a little, what can I say, a silver lining, the recently declared NFHS 5 data, which was just declared yesterday, said that there has been a 2% decrease in gender-based violence. And I hope that this decrease increases in the next few years and we are successful. Again, a little bit of good news. From Delhi and from Pune, there they have noticed that the juvenile crime rates are coming down. And what has been their technique? Their technique has been to provide adequate counseling. So remember, even juvenile crimes are coming down with counseling, and there is a huge role of understanding the adolescent, reaching out to the adolescent, giving appropriate counseling to really keep India more peaceful and calm and decreasing the juvenile crime rate. So let us now talk about what should be our clinical approach when a parent or the adolescent himself complains that he has anger issues. So the first important thing is we ourselves need to keep calm. That's very, very important. Often the parent says, my child, he screams at me, he shouts at me, he breaks things. And there's a chance when you are listening to such a history, you may get emotionally high. So take a deep breath, keep calm, build a rapport with the parents, with the adolescent, be non-judgmental. Do not label the adolescent as an angry adolescent, as a difficult adolescent. Be careful. You are here to help him in managing his behavior, not judging him. Listen actively. Identify the underlying reasons for the anger and the feelings behind the anger. And now this list can be real big. And each adolescent will be angry for different reasons. One adolescent may get angry when the parent screams at him, while the other adolescent would feel, oh, my father wants me to study, and that's why he's screaming, and I should go back and study, and he would be cool about it. So how a particular adolescent perceives a particular moment is important, and hence an individualized list is very, very important in clinical practice to help the adolescent to manage his angry feelings. Now, the second part of clinical management is to do a family assessment. I told you already what a great impact the family has. The family health systems, the family response, the family managing their own anger has a great impact on adolescent anger management. We need to get a history for collaborating with the family, with the school teachers, with the peers. And what do we need to identify and manage as pediatricians? We must manage medical disorders. If there is uncontrolled diabetes mellitus, if there's uncontrolled epilepsy, uncontrolled juvenile idiopathic arthritis, definitely the adolescent is going to be irritated and angry. If there is anemia, vitamin B12 deficiency, the adolescent is not going to be in a good mood. So as a pediatrician, we need to look out for the common medical disorders and also to manage them appropriately. We all know about the head psychosocial history, which helps us to analyze the stresses in the adolescent's life, the strengths of the adolescent. We also want to look for comorbid risky behavior. Is it only anger, aggression, violence? Is it associated with drug use? Is it associated with excess media use? Sometimes the adolescent may not tell us why he's angry. Then we often follow the technique of saying, if there was an angel who would come in front of you and ask you for those 3 wishes, what would they be? And then the adolescent says, I wish I could do well in studies. I wish my father would stop scolding me. And I wish I had more friends. So this is one of the techniques to find out what is really troubling the adolescent and why is he angry. Remember to screen for mental disorders, like I said before, and you could use screening tools or you could use the DSM-5 criteria. Be very clear about the indications for referral. For example, if there's a severe mental disorder, if there is suicidal ideation or behavior, or if there's a poor response to counseling, do not hesitate to actually refer this child to a mental health professional. Remember to be the mediator with the mental health professional, and also a mediator and a collaborator with the family, with the school and the peers. So what do? You counsel for healthy lifestyle. You talk about parent management techniques, talk a little bit about cognitive behavior techniques, strength-based counseling, motivational interviewing, and medication when there is mental disorder, or even for a simple thing like anemia or vitamin B12 deficiency or vitamin D deficiency. We need to use medication to keep the adolescent in a good mood if he has any of these disorders. So what do we do in cognitive behavior therapy in a pediatric setting? So it follows 3 things: emotional regulation, problem solving, and social skill training. So what do? We first do a baseline behavioral assessment. So we have anger inventories which are available for childhood and adolescence, which tells us in anger, what does the adolescent do? Does he just scream or shout? Does he break things, or does he hit other people? So once we have a baseline behavioral assessment, we would have an objective way of assessing whether our interventions are successful or not. We do psychoeducation. So what do? We tell the adolescent how to recognize angry feelings, how to recognize triggers, which would be individualized, how to understand consequences of uncontrolled anger, and how to really control them by skill acquisition, that is by self-talk, problem solving, learning assertive skills, humor, and even relaxation techniques. And then what we do? We do application training by giving them situations and asking them how would they react in such a situation in the clinic, and we even do role plays with them. Now, this looks quite a lot, but let me put this in a very practical way, in a very, very simple way, by discussing this with a case. Just yesterday, this 16-year-old, through a telecounseling, said to me, I have anger issues, doctor. I got very angry today. And my typical thing is when they say I have anger issues, I tell them, can you tell me a situation when you got angry the last time? And she said, just today, a few hours before I started talking to me, my mom said, are you studying, from her room? And she said, if you're not studying, you better start studying. I got so angry, doctor. I threw my favorite pen on the floor and crushed it. And now I have lost my favorite pen. I wish I had not done it. And I said, anything else? She said, another thing which I want to tell you is, because of this online system of education, I have been unable to understand the study material and prepare for my impending exams. And I didn't want to study. I wasted a lot of time on YouTube and I felt more miserable and angry. It is a hopeless situation. I can never be happy. So how are you going to help this adolescent to come over anger issues? You try telling the adolescent to be aware of influence of anger on your body, mind, and behavior. And when you got angry, you threw the pen, you crushed it down. When you got angry, you did not study. Instead, you went to YouTube and wasted your time. So you do understand that when you get angry, your body, mind, and behavior changes. And what do you need to learn? You want to learn to manage anger at a comfortable pace in a way that resolves the situation and doesn't create worse problems. What happened? When you broke your pen, in fact, you created a worse problem because you don't have your favorite pen. And when you wasted time on YouTube, your timetable for that day went for a toss. You could not study what you had actually planned to study. As an adolescent, you want to be in control of your life. You want to have autonomy. Don't allow anger to pull the strings. You decide what you want to do. What has happened here? When you threw the pen, you have allowed anger to control you. When you went to YouTube, you have allowed anger to control you. And we don't want that to happen. We want you to diffuse anger so that it does not create an explosion. So we want to look at what is the trigger. We want to think how you analyze the trigger in your mind, and you analyze it in such a way that you do not react, but you respond to a situation to diffuse anger. To put it very simply, for those of us who don't know too much of psychology and would not want to learn too much of psychology, I can summarize anger management techniques into really the 6 important phases. One is telling the adolescent about lifestyle choices, teaching the adolescent relaxation techniques, talking about self-awareness, cognitive restructuring, assertive communication, and self-talk. And of course, delivering all this through the counseling what we give. So for all of us, if we remember these 5 techniques as a pediatrician, life is going to be simple. So we want to respond to anger and not react to it. For that, we should be healthy and we should lead a healthy lifestyle, which is so very important. So what do you tell the adolescent first? And that is what I told the adolescent whom I was counseling just yesterday. Have a good sleep, exercise regularly for at least 1 hour. Your sleep should be of good quality and quantity. You should feel refreshed after the sleep, and you should sleep for a minimum of 8 to 9 hours, nothing less than 7 hours. Of course, practice meditation. And remember, when you're telling them relaxation techniques, it's not that if you love meditation, the adolescent would love that too. You have to give them a choice, give them a menu of relaxation techniques and allow them to choose what they like the best. But definitely you can tell the science behind meditation, telling them that meditation will make you less emotionally reactive and will give you good control over your emotions by working on your prefrontal cortex. Remember to connect socially. Even if there is the pandemic, remember to connect with your friends and family through the media or in person, following COVID appropriate behavior. Try to reduce your screen time and increase your social interaction. Eat a balanced diet. Eat healthy, get sunlight exposure, get your vitamin D, connect with nature, because nature keeps you grounded and is a fantastic relaxation technique. Learn new skills. It could be music, it could be dance. Study regularly, manage your time well, follow a routine, and remember to be always grateful for what you have and be kind and helpful to others. So these are some techniques of healthy lifestyle and relaxation which you can offer to the adolescent as a general rule. Also, some adolescents like to draw, and this is an example from one of my patients who liked to express his emotions through drawing while he was not able to talk. And this is an example where an adolescent has written about all kinds of things, resilience to fight against COVID. This is another adolescent who likes to do mandala art to actually fight the anxiety and anger issues that he has. And this is another adolescent who actually has written a poem which has been taken up by UNICEF. So each adolescent will have different relaxation techniques. And when they practice this relaxation technique on a regular basis, they actually increase their parasympathetic nervous system activity, which is relaxing. And also it keeps them healthy because they follow a healthy lifestyle. Now we have finished with the relaxation and lifestyle choices, and now coming to other anger management techniques, that is self-awareness, cognitive restructuring, assertive communication, and self-talk. The first thing about self-awareness is to find out what is the trigger for my anger. It could be one or it could be multiple. That's really important. And I told this adolescent that there are steps of anger management. First, recognize anger, stay calm and relax, identify the source. Were you angry with the pen or were you angry with your mother? What was the reason for anger? The reason for anger was that your mother wanted you to study, but you were on YouTube and you were getting angry that your mother is pointing out that again and again, and she was shouting from the other room. So now you decide, how do you want to express this anger? Do you want to keep quiet about it, or do you want to talk about it? And then it is up to you to choose the best option and then do it and see whether it works or not. So the first step, recognize anger. Now, when we get angry, it could be for some people, eyes start twitching, face turns red, heart starts beating faster, knees feel weak, there's headache, nostrils flare, there may be a stomach ache, or the chest feels tight, or all of this. So again, it is self-awareness. When I feel angry, what do I feel? Do I feel that sense of irritation, or do I have some body reaction, or do I feel like beating somebody up? So I know that I'm getting angry. So what do I do at this time? I can count to 10, not even reverse counting, 1 to 10, or take a deep breath. Think I have a bouquet in my hand. I take in a bouquet of roses. I smell the roses and then blow out the candle. Ooh. So this is a fantastic way of taking a deep breath, explained very simply to the adolescent. So what happens now? I am getting angry. I have asked myself to calm down. And then what do I do next? I have an anger thermometer in my mind. So my mother shouted at me, "Are you studying? You better study." And I assess myself from 0 to 10, where is my anger? My anger is probably 8 right now. Now I am really, very, I've lost control, but I tell myself, I do self-talk. It is okay to be angry, but I don't want to hurt others. I don't want to hurt myself. I don't want to hurt property. So these are the anger rules which I want to tell myself. I want to do the self-talk first before I talk to other people. So what I have done, I've recognized anger. I've told myself to be a little calm. I've tried to use my anger thermometer to see how angry I am. And then I decide, she said, I decide not to talk to my mother, and I also decide I'm not going to break my pen. So what are you going to do? You're going to do cognitive restructuring. My mother is shouting at me. She actually wants me to study well. I have to think of a way of studying well. It is not that she wants to insult me. So I stop my negative thoughts. My mother thinks good for me. I change my expectations. That is, my mother should allow me to see YouTube always. But my mother also needs to monitor what I am doing, because she, after all, wants me to become an engineer, which I want to, and I am not studying. Empathize. Yes, I have not been studying well the past few days, and my mother actually is worried about me, and that's the reason why she's asking me. So when you tell yourself all this, definitely you are going to calm down and think of a way how to study better, rather than taking up your pen, throwing it down and stamping on it. There's another two techniques which I often tell adolescents, and one is the technique of imagery, especially to be used when you are dealing with anger issues with stranger. You're going in a mall and there is one fat lady who comes and stamps on your foot. You feel like punching the fat lady. Instead, you measure your anger thermometer. It's 8/10. You cool down, go to a place. In your mind, you think you're punching her, and your anger comes down to probably 4/10. But remember not to use this imagery technique for people who are close to you. It's okay. You're not going to meet that lady again, and you have thought in your mind, and you go ahead. And sometimes also use humor and say, how funny I must be looking in the mall, punching my hand when there is actually not there. So sometimes humor is a good way to manage anger, but remember, the humor should not hurt anybody. Coming back to cognitive restructuring. So you can see this picture. For some of you, there may be two faces. For some of you, there's a wine glass. So what are we telling the adolescent? We are telling the adolescent that you stop your negative thoughts against your mother. Think positively that your mother is thinking of your good. That will make you feel more optimistic and may get you back to study, or at least think of a plan how you could overcome your difficulties in studies. But if you think your mother is always there to irritate you, you're going to feel negative, you're going to feel unloved, and you will not feel like even picking up your books or talking to anybody, leave alone your mother to anybody in the house. So that is an important technique to tell the adolescent. And if you cannot think of thought restructuring, sometimes it's good to take a time out. So your mother shouts at you, what do? You use one of the relaxation techniques, maybe listen to music, maybe color, maybe read a book, maybe exercise, take 5 deep breaths, maybe do guided imagery. This is a technique in which an adolescent thinks of his favorite place where he would want to go and thinks of the beautiful scenery, thinks of the smell, thinks of what he is doing there. And this actually has a script, and this can be taught to the adolescent, and the script can be recorded. Sometimes chanting the mantra Om has been proved by research to decrease the activity of the limbic system. So again, here, offer a variety of relaxation techniques which can help the adolescent to manage his emotions. So this young girl said, doctor, what about if I want to talk to my mother that she should not shout from the other room, are you studying? What about me telling her that if she wants to know whether I'm studying or not, she should come to my room? So I said, yeah, that's a great idea, because if you express yourself, your mother would understand you better and there would be less conflict in the family. So how do I express myself? I express myself by not being aggressive, by not being quiet, but by being assertive. And when I'm being assertive, I use excellent non-verbal communication, because 93% of our communication, especially in emotional situations, is non-verbal, which includes our body language, tone, and voice, and finally words. So don't shout from the room and say, Mom, why are you shouting at me? Tell her, go and talk to her. And what when you talk to her? You are going to say what happened. Amma, today when you shouted at me from the other room, I felt really upset. So say what happened. Say how you feel. Don't say, Amma, you're always screaming at me. You don't have any respect for me. Then say exactly me, maybe also help me with some of the, and when you do this, I will feel more. So when you're expressing a way that is not hurtful to other people, that is so very important, and follow the assertive style of communication. Oh, doctor, what if my mother does not understand this? She asked me next. Then I said, let go of the things which are not under control. Your response to her loud voice is under your control, but whether she controls her loud voice or not is absolutely not under your control. So often say this prayer, God, grant me the serenity to accept the things that I cannot change, courage to change the things that I can, and wisdom to know the difference, especially in times of COVID. This is extremely important. What is under our control is COVID appropriate behavior from our side. What is not under our control is, when will the COVID go? When will the COVID vaccine be available for children? So these are the things which are not under our control. Let things happen as they do. Let us focus on things which are under our control. Okay, doctor, that's fine. I will try some of the techniques that you told me to handle my emotions with my mother. But what about my studies? How do I handle the difficulties that I'm having? So I am totally hopeless. I'm totally worthless. I cannot do it. So then we got into the 5 steps of problem solving, and which were, so you have a difficulty in your studies. What are the ways in which you can overcome these difficulties? Talking to your parents who may help you with a few subjects, talking to your teachers, talking to your friends, taking extra online situations, discuss the pros and cons of each solution which we had thought of, form the plan, implement, actually take help from our teachers and friends for in subjects in which she was finding difficult.
Hello. Shaji sir.
Yes, can you hear me?
Yes, madam has left. I think madam will join.
Okay. I thought it was my problem because I couldn't hear anything. Yeah.
Okay, we will wait, sir.
Will she be joining now, or should we wait, or then
So we can wait. We can wait, sir.
Okay, fine. That's right. I think she had some problem with the bandwidth. Would anybody like to give their comments so that I can take it as a final question and the conclusion? Or any major questions, you can put it in the chat box, or you can tell it now. Yes, I think Dr. Preeti has joined. You are muted, Preeti. Please unmute. You are muted.
1 second, I will make. Sir, I will make her host. 1 minute.
Okay, that's fine.
Can you hear me?
Yeah, now we can hear you.
Yeah. So I'll just, I think did you all listen about the happiness jar?
No. I
Okay,
didn't.
okay. So we tell the adolescent that whenever there are episodes of happiness in your life, when probably your mother gives you a hug or your father gets you something new which you really want, please write it down and put it into the happiness jar. And when you're feeling really down or angry, you can take that and see that it's not all the time that your parents or your friends or your teachers are unhappy with you. It is just one of those instances. And when you feel I'm hopeless, I'm worthless, try to have a morning affirmation and an affirmation before you go to bed. I can do it. It is possible. It's a good thing to maintain a journal to see whether the times when you got angry, what did you do? What were the triggers? How did you interpret the situation? Which technique did you use? Whether it worked or not. This would help you to actually keep in touch with whatever technique we have taught you, whether it has been successful or not. So when it comes to parents, we teach them about parenting, and we all know that authoritarian parenting is what makes the child very, very angry, and permissive and uninvolved are also not the ideal way of parenting. The best way of parenting is authoritative parenting, understand the child, having high warmth, high demands, and also guiding the child with a lot of self-regulation. The new parenting style, helicopter parenting, where we try to suffocate the child by being with the child each moment, can also make the child very, very angry. So anger management is not only about guiding the adolescent, but also helping the parent. And there is a parent management training program which has certain steps. And this is also done over 8 to 12 weeks, just like the cognitive behavior training, in which we tell the parent, separate the child from the behavior, avoid labeling, be knowledgeable about normal adolescent development, manage and role model your stress and anger, spend one-on-one time with the adolescent, have a positive reinforcement, list out negotiable and non-negotiable rules, establish proper consequences for behavior, use effective communication, problem solving, and negotiation skills, and avoid negative cognitive thoughts. Just because the adolescent broke the pen today doesn't mean that he is going to become a criminal in future and he's going to kill people. So sometimes parents often tend to overreact because of one mistake which the adolescent makes. The point here is adolescent brain is under construction and can be trained to control emotions. We often tell the parents to have an ABC card in which what was the antecedent of the problem behavior, B stands for behavior, A stands for antecedent or trigger, and what was the consequence? Did the adolescent break a thing? Did you slap the adolescent? Did you scream and shout? Did it make the trigger better, or did it make it worse? So adolescents are asked to maintain a journal, and so are the parents. And this partnership helps us to actually help in anger management. Important also to partner with schools to reinforce school connectedness. And if there are life skill sessions, definitely encourage them. The school should have strong anti-bullying and anti-ragging measures, remedial educations with those with learning problems, counselors, and speedy mental health referrals would actually reduce anger issues in adolescents. So we all have known about these indications for referral. So I'll request pediatricians to keep this in mind. An adolescent with anger issues, do try to help, but also remember the indications for referral. Poor response to your counseling for 6 to 8 weeks is an indication for referral. So is severe mental disorder, multiple comorbidities, psychosis, suicidal ideation, or attempt. So be good friends and in collaboration with a psychiatrist and a psychologist. To sum it all up, I hope you will remember the 5 important anger management techniques of a healthy lifestyle: relaxation techniques, self-awareness, cognitive restructuring, assertive communication, and self-talk. And Aristotle has said, anybody can become angry, that is easy, but to be angry with the right person and to the right degree and at the right time and for the right purpose and in the right way, that is not within everybody's power. And that is not easy. So we are here to make difficult things easy for the adolescent. And I hope with the knowledge that I've shared today, you would be able to make all adolescents as cool as a cucumber, and the parents and the teachers and the other people in their life as well, and try to remain yourself as cool as a cucumber, and thus set India on the path of peace and harmony, where anger does not dislodge the trajectory of growth and development of any adolescent, and adolescents of today turn out to be healthy, responsible citizens leading India to great heights. Thank you very much.
Thank you, Dr. Preeti. I'm sure all of you appreciated the talk, and it was really a wonderful presentation, starting with the mechanism of how people get angry, the consequences of it, how to handle it, the cognitive behavior therapy, anger management techniques, and techniques of the parents, the schools. And really, I found it really informative, because we all get angry. Maybe I can use it for myself also. So now, if there are any questions, I'll just go through the chat box. Otherwise, you can ask it now. Ma'am, how to assess behavior is one of the questions from Dr. Jairam.
Okay, so we do have standard checklist. We have the child behavior checklist. We also have a checklist for adolescents. We also have a free checklist for the family, for the adolescent, which has been given by the DSM-5. So many of these checklists are not free to use, and they can be only got on payment. But yes, there are checklists available which we can use.
The next question is, self-awareness is equal to how adolescent recognizes anger. How can parents know that the adolescent is angry?
Yes, so I think, so how do we know when somebody is angry? So the ways that we know about anger, how somebody is, by seeing the look of the person, that is one, right? By how the person is he frowning? Is he having some, a look which clearly shows you is angry? That could be one way. The second way is in how the person behaves. Yes, so angry person, like I said, may not talk to other people, or an angry person may be aggressive, may throw things, or an angry person may not speak in a socially appropriate manner. So the way we come to know somebody is angry is by the facial expression or by his behavior, or when we see that the person is not able to function the way he would. For example, if an adolescent would love to go out to meet his friends, suddenly says, I don't want to meet the friends. So is there an issue there? Has something happened with the friends there? Is he angry about something? Now, I would also go further step and say, and if there are issues which are in terms of long duration, change in behavior or change in interest, they might point to a mental disorder. And this, in fact, the anger may be one of the symptoms of a mental disorder setting in. But remember, usually this anger, which is a symptom of a mental disorder, is usually of extreme variety, not the mild anger, which I said many adolescents have normatively angry because of so many changes which are taking place. And as parents, we want, or as even adolescent health professionals, we want to help them with uncontrolled anger. Little bit of anger which they manage on their own is absolutely fine. We need not worry about it. I would say anger is a normal emotion.
I think anger, if it's properly utilized, it's really something good. But only thing you should know how to handle it, as your last slide on quote by Aristotle. So that is what teach them all. But I have a lot of compliments for you, Dr. Preeti. Excellent talk. Very good. There's one thing, ma'am. Can you share the slide and this on about CBT? I think that's
okay. So you can just, I think you have my number. Okay, I'll just put my number here. You can, I can share for those who want, I can share the presentation without the pictures. So that will be a smaller presentation to share. So definitely what I have, this thing, I put my number. So that's my WhatsApp number. Those who want the presentation, the script part, I can definitely share it.
Thank you for that. The number which Dr. Preeti has given is 94487 01052. So you want to write down 9448701052. It's in the chat box. Now, the other one is there's a question about passive aggressive behavior. Your opinion?
Yeah. So I would say, so we all know that behavior or communication rather, right? Communication rather can be into aggressive, passive, assertive, or passive aggressive. So what is passive aggressive? I think passive aggressive is the worst kind of communication out of all the communication. So passive aggressive is, okay, for example, an adolescent has come late, right? Has come late and the mother is very, very angry, right? So what she does is she says, or even for the other parent, doesn't talk to the adolescent, keeps quiet, doesn't talk to the adolescent for days, and does not look after the needs of the adolescent. Okay, so she's keeping quiet, she's keeping everything within her, and she is also making sure that she doesn't take care of the needs. So the needs could be right from giving food to not allowing the adolescent to enter the house. Okay, so that is a kind of passive aggression which you are doing. So this is not at all justified. I would say and what is passive? So passive is you keep grumbling about the adolescent behavior within, but you try to act that you are normal, but you keep cursing the adolescent within. So that is passive behavior, which is not good for the parent as well. And the same goes good for the adolescent. So if you have a problem, passive aggressive is that he won't say anything, but he'll say, I don't want to go to the school. I just don't want to go to school. But not saying anything. Why is he angry? What is happening? Not able to say that. I don't want to say. He's not showing any aggression, but it is an aggression undercurrent. I don't want to do this. I'm not going to do this. So that is what is to be avoided. And much of the passive aggressive behavior which adolescents do is picked up from the parents. So I often tell parents that you try to follow your assertive communication style, and adolescent would do the same. Passive aggressive, no good for the person and no good for the other people around you.
Thank you, Preeti. Now, it's an awesome talk. That is what Dr. Priya has said. Those who want to listen to her, she is a faculty next week for the Kerala Pedicon at Cochin. You can listen to her next Saturday. So thank you very much, Preeti. It was really, as usual, it was really a talk. It's always a pleasure hearing you talk.
Thank you so much, sir.
Now, if there are no more questions, I'll hand it over to Dr. Ranjit, who is the Secretary of Kerala AHA and the coming year's EB member, Central AHA. He has been elected recently. So congrats, Ranjit, on behalf of all of us, and over to you. Ranjit, we can't hear you. You're muted.
Okay. Thank you, Shaji sir, for the excellent moderation, and thank you, sir. And thank you, Preeti madam. It was always an excellent talk. It was always a pleasure to hear your talk. Why the participants who listen to your talk always will realize that why she is a doyen in the adolescent medicine. So thank you, ma'am, for accepting our invitation and came for the prestigious Doyen series, Meet the Beyond the Horizons, Meet the Doyens. And thank you, Shaji sir, for excellently moderating our session. And thank you for guiding the AHA Kerala chapter. Thank you, sir. And also, I would like to thank our Vice President, Sindhu Madam, for presiding the function, and Dr. Ajay for coordinating the meeting in a successful way. And Dr. Saeed Sabik, who hosted the session for us today, our web editor of IAP Kozhikode, and all the participants who joined for the meeting. Thank you all. Have a good day. We can meet next week in the Kochi Pedicon. See you, madam, there, and see you all there. Thank you. I've been waiting all of you for the Kochi Pedicon the next week. Thank you. Good night.
Thank you. It was my pleasure and honor. Thank you so much. Thanks.
Thank you, ma'am.
Thank you, Ranjit.
Good night.
Good night.
Thank you, sir. Thank you, sir. Good night, sir.